Hello, I'm Delaney and I'm a nursing student at ASU. In this video, we are going to be showing a simulation of a child experiencing a febrile tonic-clonic seizure and covering what nursing tasks need to be completed before and during the seizure. Throughout the simulation, we are going to break down implementation of seizure precautions, tasks during a seizure, and after a seizure is over. We hope that you find this video helpful.
Hi Lisa, I have to go to the Pyxis to remove 240 milligrams of acetaminophen and 220 milligrams of ibuprofen for my patient. The situation is, Maddie is a 5-year-old female. She weighs 21.9 kilograms. Her background, she has no known allergies and is on antibiotics for an ear infection, but her temperature has really spiked. She had a seizure due to a fever last year around the same time of year. Her assessment is a fever of 39.4 degrees Celsius. Her heart rate is 130 beats per minute. Her blood pressure is 95/52, her respirations are 40, her pain on the FACES pain scale is a 4, and she has been feeling nervous. Her mother's here, but she stepped out to use the restroom. She should be back. Because of her age and temperature, she is now at risk for seizures. I recommend you initiate seizure precautions while I run and grab her medications.
All right, thank you for the SBAR. I'll take care of her.
Okay.
Hi, Maddie. I'm a nurse helping you out today. Can you give me your full name and date of birth?
My name's Maddie and my birthday is September 16, 2006.
All right, Maddie, so you're here for an ear infection, and because of that infection, I'm gonna do something to make you a little more safe and comfortable.
Okay.
Elisa is performing her 360 room check. She then ensures that the oxygen and suction are functioning properly and that she has the appropriate equipment available to prevent aspiration and hypoxia. Next, she is placing Chuck's pads under the patient's peri area and pillow to absorb any bodily fluids that may collect during a seizure. She is now raising the side rails, patting them, and ensuring that the bed is locked and lowered to prevent any further injury. Lastly, she makes sure that the patient has her call light.
Okay, Maddie, it looks like you're all good to go. Do you see this big red button? Press the button if you need anything, like a drink of water, or if you feel like you're gonna throw up, okay?
Okay. Nurse, I don't feel so good.
Signs and symptoms of a tonic-clonic seizure include eyes roll upward, immediate loss of consciousness, generalized stiffness, increased salivation, arms flexed, legs, head, and neck extended, and a piercing cry.
Can I get some help in here? I'm coming.
During a seizure, the nurse should remain calm, time the seizure activity, Lower the patient to the floor if they are sitting or standing. Place a pillow or rolled blanket under their head for cushion. Remove any objects that could cause injury to the patient out of the immediate area. Loosen tight clothing and remove glasses if necessary, and allow for the seizure to end. If the patient begins to vomit, turn them to their side to prevent aspiration. In the event of a seizure, the nurse should not attempt to restrain the patient or put anything in the mouth of the patient. After a seizure has ended, the nurse should remain with the patient, time the post-ictal period until the patient no longer has an altered level of consciousness. Check for breathing. If the patient is not breathing, begin rescue breaths and call for help. Check for any possible injuries and assess the inside of the mouth to be sure the tongue or lips haven't been bitten. Following a seizure, the nurse should not give food or liquids until the patient is fully alert and their swallow reflex has returned to normal.
Okay. And now we will now document the seizure, the start time to end time, signs and symptoms during the seizure, and we will then perform vital signs once the patient is stabilized.
You have witnessed a successful response to a febrile tonic-clonic seizure, as well as the steps to implement seizure precautions. Some interrelated concepts include safety, because the seizure precautions were in place to provide a safe environment, and the way that the nurse responds to a seizure is based around keeping the patient safe. Education, because it is important to educate the patient and caregiver of the risks of seizures and what to look for in the event of a seizure occurrence. Lastly, thermoregulation, because this is a febrile seizure, meaning it was triggered by an uncontrolled temperature. We hope that you enjoyed our video and feel better equipped for when you are faced with a seizing child and what seizure precautions include. Thank you for watching.